Welcome this afternoon to our media availability and live stream to the broader community. Thanks for joining in. Today, another announcement yesterday from the Government of Canada for the Canadian Emergency Response Benefit. The federal government launched the application process facing unemployed due to the COVID-19 crisis. So applications are available to go in, and I think they've got a prescribed way in terms of how you do that, whether it's by direct deposit or through the mail. Obviously, direct deposit, you can get your check and resources in 3 to 5 days, and by mail, it would be about 10 days. So you have a choice to make in terms of how you do that, but it's good news that it's now available and hopefully ready to help those that need these assets and resources in our community. We continue to talk with our federal and provincial partners on a regular basis. The last conversation I had was with the Minister of Infrastructure and Community Services, having them appreciate that municipalities are also struggling with decreasing revenues and increasing costs, and at some point there needs to be a discussion about a bailout for municipalities, and they certainly appreciate and understand that, although their primary focus right now, as it should be, is to help individuals and businesses in our community get through this crisis over the next few months. There are various financial supports in the package. You can get all of that information on hamilton.ca/coronavirus-financial support-individuals. That information should all be there in terms of how you connect and what kind of resources are available for you. So do take advantage of that singular source in the website. And a reminder that as of today, city facilities will remain closed until May the 25th. The public can still do online business with the city in the way it has done in the past. All of your counselors and support staff are all functioning and working. And so any comments, complaints, or issues that you need to have them deal with, you can still connect with them in the usual way through their email and phone numbers. Please remember that the closure of the stairs, the waterfalls, the parking lots, the beaches, the play structures are all closed to protect your health and safety. Please do not override the protective tape that's there or ignore the signage. It is there for your protection. Please adhere to it. It's very important that you continue to follow on that very important timeline. And you know what, by virtue of what I saw over the weekend, most of you, if not all of you, most of you are doing exactly what you're asked to do for all the right reasons. So as I said on the radio this morning, the power is in you to manage this crisis. The steps that you take and the actions you take will make all the difference in the world in terms of how our healthcare system responds and how we are able to knock down the virus. You'll hear more about the city closures from Paul Johnson today and some enforcement issues from Chief Gert. Just want to remind that, a lot of people are doing spring cleaning, and probably a good time to do that. I've done a little bit of that myself, maybe clean out the closet or the sock drawer or whatever it is that you need to get to. Unfortunately, the drop boxes cannot be picked up right now. So generous donations are welcome, but they shouldn't be delivered to the drop boxes and or the other locations that normally take them, because for health reasons, they cannot be taking them right now. So hold on to them. The collection I have put together is in my garage, and when things settle down and all things return to reasonable normal, I'm sure all those donations will be very, very welcome. If you're to drop them in a drop box now, then the weather will render them useless before too long. So please don't drop anything in the drop box at this point. And a reminder that transit is for essential rides only. Please adhere to those physical distance measures as much as humanly possible. And I know that the transit system is set up to be more easily usable in that way. Continue to enter at the rear of the bus. And as of this past weekend, the added benefit of DARTS being able to provide bus stop to bus stop service for customers using wheelchairs, scooters, or mobility devices is now available. So you can get a hold of DARTS, hopefully an hour before, but if you can do it in advance, even more so, all the better. And they'll be able to get you to a bus stop and get you connected in that way, which would have been more difficult without this service being available to you. The private personal Protective equipment donations are coming along very nicely, and we've heard from our partners there is a shortage, not only here, but right across the country. And we do appreciate you thinking about providing either surgical masks or N95 masks or impervious gowns, gloves, face shields, hand sanitizers, whatever you might have that you do not need to use right now. Please get them to us at ppe@hamilton.ca. or at 905-546-2424, extension 2257. Make an appointment and we'll come up and gather those materials up and get them to the frontline people that need them so badly. As per the provincial order, organized public events and social gatherings of more than 5 people are prohibited. So please stay home as much as possible and do as you're asked to do, and I know that the chief in a minute will talk about the kind of enforcement that he already has been doing, and I'll talk a little bit about the bylaw that's coming that will provide the MLE, our municipal law enforcement, some additional authority to do some fining as well if people aren't doing what they're supposed to be doing. City of Hamilton Recreation Division has put together a list of activities for residents to try at home. So while you're doing your part to stay at home, the Recreation Division wants to remind families of the role that active and creative play is in helping to keep us healthy and well-balanced. So encourage everyone to check in regularly to see what activity challenges are posted. So you can go to www.hamilton.ca/rec@home to access these activities. And surely I think you'll be impressed by some of the suggestions they're making in terms of how you can stay active at this point. So on that note, I'm going to turn it over to our Emergency Operations Director, Paul Johnson, who will give you some updates in terms of the latest changes.
Thanks very much, Mr. Mayor, and certainly enforcement is the theme of today. I'll just say that, you know, our municipal law enforcement folks are working collaboratively with the police to enforce various elements and remind the public that currently physical distancing is not something that we can enforce from our bylaw perspective, but as the mayor said, there is a motion coming to our council this Wednesday, so 2 days from now. So there will be some new things that may unfold depending on how council wants to go there. With all the enforcement discussions, really it comes back down to our core message, which is stay at home as much as is possible right now. When you need to go out, you must practice that physical distancing, and wherever you go, we want you to practice that as well. But the whole goal here is that we do as little as is humanly possible in terms of trips outside the home. And if you keep that to the absolute bare necessities, that will limit our need to worry about the enforcement of that physical distancing. I want to remind the public that our golf courses are closed. That is the entire golf course. They're not just closed in terms of not playing golf. The golf courses themselves are closed. They are not public parks, never have been, but in this time when they're actually closed and with no golf happening, they are not public parks. They're not places to walk and use as a public park. The reality is there's open water on the golf course. The reality is we do have staff out there maintaining the golf courses so that when the season, if it does open up, we'll have our golf courses ready to go. And the bottom line is it's a facility that is not meant to be a public park. So please stay off our golf courses. And I know a few people have run into, I think, the police along the way in terms of the use of those. The mayor mentioned some of the transit pieces. There will be lots of signs going up on our buses in terms of keeping physical distancing and identifying some of the seats that are no longer available for use to protect our drivers. So respect those signs, respect those areas. And as we mentioned, our goal is to keep our transit system moving and keep people moving around this city. And we've done a number of things, including the partnership with DARTS, in order to make that happen. Lots of people interested in parking. So let me just remind you that we have suspended some enforcement of parking based on the fact that obviously lots of people are staying at home and working from home, and some are even self-isolating, and really need us to be a bit more lax in terms of some of the residential parking enforcement. So some of the things that have been suspended until further notice include the 12-hour time limit for parking on city streets, which obviously is a challenge for folks who are self-isolating or having to stay at home. Any of the on-street sign time limits, such as 1, 2 hour, 3 hour time limits in residential areas. The time limit exemption permits for city streets with posted time limits, any of the fines associated with vehicles with expired Ontario license plate stickers, and the commercial vehicle time limit regulation for vehicles that need to remain on the street during this time. All of those have been relaxed. There are still lots of places where parking is still going to be enforced. So if you're doing things that are unsafe, those include parking in no stopping and no parking zones. There will be enforcement. If you're parking and blocking a fire hydrant, if you're blocking somebody's driveway, there will be enforcement. So we need to make sure that we recognize that it's not a relaxing of everything to do with our parking regime. It's just to allow within those residential areas far more flexibility for people to have their cars parked for long periods of time. We noticed that, or we have announced that there's not as much enforcement of the fares in certain of these surface lots, but a reminder that the Convention Center and the York Parkade are still paid parking, so you'll need to ensure payment there. Leaf and yard waste is suspended until further notice. The curbside leaf and yard waste, you can either hold on to it or you can take it to the community recycling centers. And we really continue to encourage residents to make a few small changes in the way we collect waste. And that is that we're asking you to place used tissues and napkins in the garbage rather than the green bin. And where possible, use liner bags, either the paper ones or the certified compostable plastic ones in the green bin as well. And ensure that all your material placed in the garbage bins is actually bagged and not kept loose during this period. Just helps us keep safe. It keeps our employees feeling comfortable in their work environment during this time. And although normally we love to have interaction with the public, given the physical distancing, please just drop your garbage at the curbside or wherever it's to be picked up. Let our folks do their job and maintain and respect that 6-foot buffer zone for the folks that are out there doing their work. Over the weekend, the city installed portable washrooms and hygiene stations outside of First Ontario Centre. It's really at the corner of York and Bay. And those are so for those in our community experiencing homelessness, that they have access to these facilities in a central location. That is in addition to the work that's been done to extend hours and days of service and drop-in programs across the city. And of course, the fact that our emergency shelters are open. So we're trying to put more supports in place, and throughout this week we'll have additional announcements about our work with homeless populations. So some of these changes in services, I still get asked the question, we've reduced service, when's that coming back to full capacity? And I would say as an emergency operations center, we're still very keenly aware that these next few weeks are going to have an impact on our community, depending on how bad the surge is in cases of COVID-19. We saw an example of that over the weekend, not with our city services, but with another service in the community, when the Cardinal retirement residents went into crisis because of a lack of staffing. And Elizabeth will have an update in terms of the cases there. But a number of us, including the city and public health, as well as health partners in our hospitals, needed to rally around a situation that was born out of the fact that staff were no longer there in numbers that could safely operate that facility. So those are the kinds of things that can happen, and they can happen very quickly. And so all of the services at the City of Hamilton, we're working to keep our employees safe. We're working to do the things that will allow us to continue to deliver service and not have disruptions, which can, as I say, come upon you very, very quickly as people get sick, or they're in contact with somebody who's sick and feel that they can no longer come to work. So that's what we're focusing on at the Emergency Operations Center in these coming days and weeks, is how we maintain services and don't have panic disruption of service, and also in those services that care for people in our community, be they vulnerable or otherwise, that they're able to maintain service as well. So with that, I'll turn it over to Elizabeth.
Thanks, Paul. So today we're at 170 confirmed cases here in Hamilton as of noon today. There are, of course, more details about those cases on our website in terms of risk factors, exposure, that sort of thing, but a few important highlights. There have been 5 deaths at this point, so this is 2 more than we spoke about last time we reported. 3 of those came from the outbreak at Heritage Green, which we previously talked about. 1 new one was from the Cardinal retirement residence, an 80-year-old female from the transitional care unit. And the last death that was reported was somebody who had lived in the community and was not related to one of the outbreaks. This was an 89-year-old male. At this point, there are 39 cases of COVID-19 that indicate there is spread in the community. So again, underscoring that. And again, the community-acquired spread is getting to be more and more, greater and greater proportion of our cases. Overall, the good news, we have 71 cases that have been resolved, which is fantastic. Again, for most people, this will be a bad cold in terms of what they get. But of course, it is those people who are at higher risk of complications, people who are over the age of 65 or 70, people who have long-standing medical conditions and who are immunosuppressed, who are most at risk. And of course, those are the ones that we're trying to prevent most of all from getting ill. The four institutional outbreaks that we have going on right now are at Heritage Green, the one that you've heard about before, where we have 10 confirmed resident cases and 3 confirmed staff. At the Cardinal Retirement Residence that Paul was just speaking about, we had 14 confirmed residents and 5 confirmed staff. 8 of those residents were moved out of the home on Saturday and into hospital over the weekend. At this point, there are no other moves planned, but we're monitoring that situation very closely, as you can imagine. Wentworth Lodge has also had 1 staff member confirmed. So we do, anytime a staff member or a resident is positive for COVID-19, we declare an outbreak. It may not be related to transmission at the lodge at all, but we do declare it if there's a single staff person involved, as is the case at Wentworth Lodge. As well, at St. Joseph's Healthcare Hamilton and the Special Care Nursery, 3 healthcare providers have tested positive in that unit. It's important to note when we talk about healthcare providers, they're not always people who provide direct care. We get that question sometimes. We include anybody who works in a hospital setting as a healthcare provider, whether they're a clerk or an administrator, they're all included. So one of the healthcare workers in this situation had no direct contact with patients or families, and the other two had limited contact while wearing a protective mask. None of them were symptomatic while caring for any babies or for a family. Contact tracing is underway to ensure all of the babies, the family members, and staff and physicians who had direct contact with the positive healthcare workers are tested, and appropriate measures will be taken to limit transmission. You may notice that we're using testing in this case for everybody. This is a very special situation. It's not what we would do in every situation, but because of the nature of the unit that we're working with, we're using testing a little more extensively. None of the babies or parents in the unit are symptomatic. All are being monitored closely. We do know from the experience in other countries that babies in general experience mild symptoms and recover from the illness. There's, of course, limited experience when it comes to babies that are in special care units or in ICUs, but so far the evidence, though limited, is promising for those babies as well. They have created a separate space for infants who may have been exposed during this time period. So what they're doing is moving anybody who had been exposed into a separate space, cleaning the space where the exposures might have been, and then and continuing to accept babies that require care into the unit. It is Easter weekend coming, as we've talked about. We know this is a very special time for families and a very important time for many religious communities. It is very important, again, that we stay as close as home as possible. It is okay to go outside, get some fresh air, a little exercise in the backyard, go for a walk in your neighborhood, but ensuring, of course, to keep that 2-meter distance at all times. So I know it's going to be a tough weekend when we're not able to get together with families, we're not able to see our friends, and I know for some of us, our kids are getting bored, our teenagers are getting bored, and we'd all like to be moving on to something else. But the way we do that best is by controlling the spread of this and limiting how many people get sick overall. There is a new announcement just today about non-medical mask use. So Dr. Theresa Tam, who is the Chief Public Health Officer for Canada, has now advised that people wear non-medical masks in grocery stores, on transit, and in other circumstances where physical or social distancing is difficult. It was announced earlier today. It is more of a permissive in terms of saying this is something that people can consider as an option. The non-medical mask is really used most of all to prevent you wearing the mask from spreading the disease to somebody else, not so much to stop you from getting it. And the reason for that is that The reason why they're recommending it is we know that in those 48 hours before you become symptomatic, there is a possibility of transmission. So that reduces the amount of droplets that you might be producing and spreading to others. It's not a recommendation or an order or anything like that, but it is an option that we have available to us that people can use to help to reduce spread. That's it from me, Chief.
Thank you. And I'll give a bit of an overview here about enforcement. So we have seen drastic changes. Sorry, you got that on. We have seen drastic changes to how we live and work over the past few weeks, and the legislation has changed to reflect that. We know that in order to stop the spread of COVID-19, it requires a concentrated effort from everyone in our community, and we take the lead of public health on this. We're being asked to physically distance from our friends, extended family, and our colleagues. Laws have been put in place to ensure we comply with physical distancing in order to stop the spread of COVID-19. This weekend, as mentioned by Dr. Richardson, traditional faith celebrations are going to look much different than they normally would. Under the provincial state of emergency declaration, events of more than 5 people are prohibited. This means private social family gatherings or religious celebrations for Easter, Passover, or other faith-based holidays can't take place. Residents organizing or attending gatherings of more than 5 people may be charged under the Emergency Management and Civil Protection Act, which carries a fine starting at $750, and this does include private residences. We're told staying apart today means we can be together tomorrow. We recognize it's challenging. As the weather improves, we naturally want to enjoy time with friends and family, but it can't happen right now. People must keep their distance. We know most people are doing the right thing, as mentioned by the mayor earlier. We also know there are a few people who are choosing to ignore the steps that have been put in place for everyone's safety. As a police service, our job is to keep the community safe. This is done through education and enforcement. And you should know that we're still doing all the calls for service we normally would do for the public. We've made a few changes to reception at our stations where you will be questioned in terms of COVID symptoms. And we have prioritized certain calls to be done by phone. But we still continue to investigate mischiefs, break-and-enters, thefts, domestic violence, child abuse, sexual assaults, all the things that we would normally investigate, including traffic enforcement. You need to know our members are out patrolling our neighborhoods and ensuring compliance. So we're all in it together, and we can do it together. Thank you. Mr. Mayor.
Great, thank you very much. And, obviously kudos go out to not only the police service, but paramedics and fire and all those that are working the front lines right now, including pharmacies and grocery stores, folks that, are putting aside the risk and understanding that we need to keep our community functional and safe, and we appreciate all of that effort, and I think the community at large appreciates that as well. So thank you for all of that great work. I do want to give a shout out to a couple of folks, Nations Foods. They've provided 10,000 pieces of protective masks to the City of Hamilton Public Health. Thank you so much. It's so much in need. So thank you to Tom Lynn, the President and CEO of Nations Fresh Foods, as well as Lillian Kwok, the President of the Hamilton Chinese Business Association, for this very, very timely and very, very important contribution. And anyone else that has protective equipment, again, ppe@hamilton.ca. Get a hold of us there, and we will come and collect whatever you might have. As well, identified in the media, Charles and Margaret Juravinsky, our generous healthcare donors, have contributed $3.3 million to accelerate the COVID-19 research at Juravinsky Research Institute here in Hamilton. Thank you to them very, very much. They have put in tens and tens of millions of dollars into the healthcare system, and they've maintained that commitment and to our community, and we thank them so very much on making this contribution that will help in the research to try and overcome this virus sooner rather than later. So thank you for that. A big shout out to the Gage Park Delta West neighborhood. This neighborhood held a social distancing party on Saturday. Each household gathered on their respective front porches and waved and chatted to each other from a distance. And they actually put their porches, they got on their porches instead on their couches and spent the evening together basically physically distancing, but staying socially connected. So well done. That's the kind of community spirit we'd like to see in all of our city. And I'm sure it's happening in many, many other places as well. It's the kind of thing that will get us through. Staying socially connected but physically apart, unfortunately, is the mantra today, but that doesn't mean we have to abandon our friends and our family. There's myriads of ways that we can connect, both through digital media and through, a porch party that, neighbors can stay at a distance but still communicate with one another, or sing songs at one another, or bang pans, which is happening in some quarters around the world and in our community. So thank you for that great effort. And I'm also going to ask all churches in the city to join in Wednesdays and Sunday evenings at 6 p.m. by ringing their bells in chorus of gratitude in support of our healthcare workers, our doctors and nurses, our pharmacists, first responders, police, transit operators, grocery store clerks, and anyone else out there that is working the front lines and keeping our city functional and safe and providing health care in our communities. So Wednesdays at 6 o'clock and Sundays at 6 o'clock, if we can have all the churches chime throughout the city, I think that'll be a great tribute to the first responders and healthcare workers out there that are out there working each and every day to keep our community safe and provide care for the ill. So that starts this Wednesday night. So at 6 o'clock Wednesday night, please ring your bells. And as well, we want to thank our sign language interpreters, Rosalie Vizers and Georgia Whalen, for their 30-minute workout each and every time. Thank you for continuing to share the word with the hearing impaired or the deaf in our community. Thank you. I'll get that terminology right one of these days. And folks, you can get all of this information by going to hamilton.ca/coronavirus website. Virtually everything that we're sharing with you, whether it's community or business or investment income or ways to get to some of the announcements the federal and provincial governments are sharing, is available to you on that website. And for those in business that are looking for business support, the investhamilton.ca website is up and running, and all the online services that are available to you, you can find there as well. Keep checking into that website, and the Hometown Hub is also up and running. And it's really an effort to keep those that are online functioning and working and providing service in our community at a distance. And so, again, the Coast Helpline is 905-972-8338. That's the number you can call if you're having mental health challenges in our community. The Coast Police and public health staff are available to you to help in whatever manner they need to, so do call. And the Kids Help phone, very important for kids in our community right now. Some of them are either in stressed domestic situations or potentially homeless or having challenges in terms of dealing with some of these issues and don't have anyone to reach out to. You can call the Kids Help phone line 24/7, anytime during the day, at 1-800-668-6868, or you can text at 686868, and that's the Kids Help phone line. And I'm sure there's lots of kids out there that might be wondering what's going on, how can I get help? You can go to both of those resources, early and often. And again, a reminder, as Dr. Richardson said, maintain that 2-meter separation, that hockey stick length at all times. Whether you're in the grocery store or the drugstore or standing in line waiting to get in, maintain that 6-foot hockey stick separation. And we will be doing what we need to be doing to ensure that we don't spread this virus. And a reminder again that you can donate blood at blood.ca. The blood bank still needs your donations. There are lots of surgeries still going on, and those contributions need to keep coming in. So get to the website at blood.ca, make an appointment locally here as to how you can make a contribution to the health and well-being of your fellow citizens. And on that note, I'm going to turn it over to our media representative and ask if there's any additional questions.
Thank you, Mr. Mayor. I'll just remind all of our media partners on the phone to please keep yourselves on mute. One question and one follow-up for each of you. First will be Dale from CHCH. Dale, go ahead.
Hi, this question's for Dr. Richardson. I know contact tracing is underway, but do we have an idea of how many healthcare workers or healthcare providers have been put into isolation as a result of the outbreak at St. Joe's?
I don't have specific numbers with me at present. That's still all underway.
Okay, and are there any additional measures being taken or considered to help prevent more outbreaks from happening?
So it's something we're always thinking about in terms of what we can do. You know, there's been a number of different things that have happened, everything from, of course, long-term care homes being asked to close their doors to anybody but staff, that the people who live there aren't able to go on a family visit or anything like that. There's different discussion about how we can increase things like use of personal protective equipment. Might that make a difference? Of course, acknowledging that we have a short supply of it overall. So we're always looking for new ways. We've got most of the ways we operate in an outbreak situation going on even in non-outbreak facilities. So there's a lot going on, but we're always looking to see if there's anything more that can be done.
Great, thank you.
Next question's from Tevye from The Spectator. Tevye, go ahead.
Oh, hi there. I was wondering if either Paul or the mayor could tell us how we are doing as a city for personal protective equipment. There was some concern last week that we were pretty short.
So Tevye, it obviously varies by equipment. We're down to, we don't have months of supply. We're down to weeks of supply depending on the various equipment. And we really need that injection to come in provincially and obviously federally through the provinces. So we're not in a condition of panic. None of our services are saying that we're within a day or two of running out. But the other piece we know is that we're going to start protecting, in certain cases, we're going to have to use more protective equipment because of outbreak at Wentworth potentially, or not. It is from a staff perspective there. We hope there's no more cases there. So we may have to do a little bit more of that work, which will burn through a few more of our supplies. So we're very hopeful that this week, all those indications of getting some more supplies actually come to fruition, because I think going into next week, a week from now on this Monday call, it might be a bit of a different story. We might start to say now we're getting down to the short strokes, but we're in not bad shape. Our staff need to understand we have supplies on hand. And in the case of the Cardinal retirement residents, we were able to provide them with a small amount of PPE because they urgently needed it on Friday night. So that gives you an indication that we do have some that we can also help in critical situations with our community partners.
Thank you, and I'll direct my second question to Chief Gertz. Chief, you may have heard earlier today there was some criticism or concern, rather, from members of the legal community, the street outreach community, and those who, some healthcare providers as well, that some homeless people were being ticketed under the new provincial legislation. I think the police have explained in these types of situations they'd like to provide some sort of warning, some sort of education. However, I would say in these cases, people who necessarily can't pay $750 tickets are issued these tickets. Is there any other way to get around this as a last resort?
And thanks for the question, Tevye. Probably the short answer is compliance. As you know, we take a graduated approach to this. Our officers do exercise discretion. In the cases you mentioned, without getting into it, the people were warned, told about the distancing and the grouping. In fact, as I understand it, some were sharing a bottle between themselves. When you look at the messaging from Dr. Tam all the way down to Dr. Richardson here, that exposes those homeless people to a potentially life-threatening situation as well. So we do take it seriously. If we can get compliance, that's what we want first. And really, that's the message today, whether we're coming up to the Easter holiday or a Passover or otherwise. We would like to see a different situation as well, and I'm sure you've heard the Premier talk about it. It's a life-threatening situation. So we want compliance first. We've certainly explained it to a number of people. Some people remain oppositional. Then we're put in a spot where we may have to do enforcement. And obviously, that's our last alternative. But much like any other compliance with the law, whether it's speeding or domestic violence, sometimes we have to take enforcement action. But we'd prefer not to do that.
Thank you.
Next question goes to Samantha Craigs from CBC. Go ahead, Samantha.
Hi there. Thanks for taking my call. My first question, I guess, is sort of a basic one. Mr. Johnson, when you're talking about the PPE supply, are you talking about hospitals as well?
No, I'm talking about the city. Hospitals, we're certainly linked in across it, but I'll let the hospitals answer. They would have to answer in terms of where their supplies are at. I can tell you from our conversations, because we work as a system here in the city, that they're feeling the same pressures, that they're very concerned about their levels, and as the surge starts to occur, they go through more of the PPE as well. So at a high level, I can say their concern is about as heightened as ours is. This is a heightened concern across every call that I'm on, whether it's provincially, whether it's locally, whether it's around our EOC table. I think it's the one piece, and it's a challenge because it's the one thing that we can't totally control. Our supply chain has been disrupted, so the normal places we would place orders and know when we're getting them have all been adjusted. And on top of that, we as the city obviously are contacted by a number of our partner organizations who have seen their supply chains disrupted. And so all of the places that other organizations purchase things through, those are no longer either as readily available, or it's a flat out no. So we're seeing the challenges back up, and I can tell you that it's as big an issue for hospitals as it is for the city.
My other question is for Dr. Richardson. Given the directive for people to wear non-medical masks when they go to the grocery store, where should someone in Hamilton find a mask like that?
So there are actually very good instructions on the Centers for Disease Control website around how to make a mask from things you would have at home, things like a bandana or t-shirt material. You're wanting to get stuff that's closely woven to make that mask out of. And so I would take a look at those, because there's some important principles there in terms of what you're looking for, rather than just going and buying any mask that you might have off the shelf. We're asking that people don't use medical masks, because those medical masks are so very much needed by our healthcare workers, who are definitely, on the front lines and being potentially exposed to COVID-19 every day. It's most important that we reserve those medical masks for that group. But for people, what we're primarily trying to do is to stop them from spreading it. And so for people to use some sort of a mask that meets the kind of criteria you see from the CDC is a way to go about it.
Okay, thank you.
Next question is from Lisa Poleski from CHML. Lisa, go ahead.
Hi, thanks. I'm not sure if the city has any sort of jurisdiction in this. We've been getting some concerned emails from people who work at various nursing homes in the city, and given that there's been outbreaks, there's some concern that the management at certain facilities aren't, following the directives from public health and whatnot. I just don't know if there's anything necessarily that the city can do to kind of enforce, wearing protective gear and, kind of mandating self-isolation if people have returned from holiday and things like that. So I just don't know if you can provide, because we've been getting many, many emails, and I just wanted to send those people sort of, whatever message that the city might be able to communicate on their behalf, I guess.
Thanks, Lisa. I think it depends on exactly what it is that they're concerned about. If it's a travel-related issue, it really does belong with others. If it's, some issue around, for some reason around distancing, that's something we can talk about. But if it really is something about, in an outbreak situation where people aren't following the advice, aren't following good infection control advice, then they absolutely can drop us a line through our hotline and talk to us about those things. We'd really encourage anybody who's a worker to be working those out with their employer. And for any institution that's in an outbreak mode, we are in contact with them each day to talk about how things are going, to make sure that everything is going okay. But if there are concerns, they can call us. We can look into it and make sure that people are following the appropriate measures.
Thank you very much.
Can I add to that I've received emails and calls from individuals as well claiming that certain facilities are not adhering to the appropriate practices, and I've referred them on to public health, and they do go and check to ensure that they're doing all the things that they should be doing to protect either the individuals in there or the staff that are there. So I think those calls are important. I wouldn't want anyone to be discouraged from calling or sharing information. If they're wrong, then at least we better safe than sorry. But the reality is that potentially people's lives are at stake, and so if there are facilities out there that aren't following the proper protocols, and there are people or staff or parents or family members that have concerns, please do call, because I think it's very important that we at least check it out. And I know that I've referred a number of them to our public health division, and they've checked them out, and things have been resolved. So don't be discouraged to. Be encouraged to call. Let me make that not a double negative. Be encouraged to call the public health or the hotline so that we can be aware of where the concern is and something that can be followed up on.
Okay, next question goes to Joanna from the Hamilton Spectator. Joanna, go ahead.
Hi, thanks so much for taking my question today. Dr. Richardson, can you tell us a bit more about the 2 deaths? Like, I'm looking for things like when did they die, where did they die, how long was the man in the community sick, and did he go to hospital at any point in time?
So I can tell you in terms of the latest 2, the cardinal death happened over the weekend. This was an individual who is in the home. The other death that happened was somebody who came from the community. They were in hospital, and I believe that one happened over the weekend as well.
And can you also tell us how many people are in the ICUs in Hamilton right now with COVID-19?
Absolutely. We're still at 2 as of noon today is our report back from the hospitals. We're grateful that that's still the number here in Hamilton, and of course that's one we're watching closely.
Thank you. Next question goes to Katrina, also from the Hamilton Spectator. Katrina, go ahead. Are you there, Katrina? Okay, maybe Katrina had to go. Just checking if we have anybody else that we didn't get to yet on the line. Okay, hearing none, I'll pass it back to you, Mr. Mayor.
All right, thank you very much, and thank you to the police chief, Gert, and Paul Johnson and Dr. Elizabeth for being part of the update today, and to all of you for tuning in. I do want to announce or let you know that we're changing the schedule a little bit this week. I think last week we announced that we're going to do the media availability Monday and Friday. Unfortunately, Friday is Good Friday, and I think most people will not be available, so we're going to be doing that one on Thursday, and we will still be hosting our town hall at 7 o'clock on Wednesday. We are heading into the holiest of holy times, Passover, Easter, and later in the month Ramadan, and with apologies to everyone, as much as we all want to celebrate those great hallmark each and every year, this is something that we cannot do this year. So, do a rain check on celebrating the Easter or that Good Friday hike that many people are accustomed to taking. Maybe put a rain check on that for sometime in September or October. Probably not a wise decision to do it this year unless you can do it safely with only your family, not added guests, and maintaining that spatial separation at all time. But best of all, that maybe you don't do it at all, and then save it for another day, so that we continue to